We're here with Dr. Sharma, who's a cardiologist at Guthrie Cardiac and Vascular Center. And last segment, we talked about congestive heart failure and what it is and what the symptoms are. And today we're going to talk about how it's diagnosed. If you just could explain how it is diagnosed.
Well, thank you, Kara, for this question. Well, the diagnosis of congestive heart failure basically involves a thorough history taking and exam by a cardiologist. And your cardiologist basically does a battery of investigations to diagnose congestive heart failure that may or may not include an ultrasound of the heart, which is actually a non-invasive testing and can be done within 15 to 20 minutes. There are other tests involved, which could be some blood work, like ECG or even a chest X-ray.
Okay, and then after you're diagnosed, how is it treated?
Once we know what causes congestive heart failure, treating or reversing the cause is actually one of the most important treatment modality. Now, there are two ways in which we can treat congestive heart failure. One is giving patients medications, and there are many medications available that has been shown to reduce or decrease the mortality and morbidity of these patients. And some of these medications are ACE inhibitors like lisinopril or fosinopril, and I advise all my patients of congestive heart failure not to stop these medications before consulting with a cardiologist. There are other classes of medications like beta blockers, for example, carvedilol or metoprolol, that has also been shown to reduce mortality and morbidity. Now, if your cardiologist finds that there are blockages in your heart arteries, then he may or may not recommend stress testing. And depending on the results of the stress testing, he may or may not recommend a coronary angiogram, or in other words, to kind of take a look at the heart arteries. And if he finds any blockages in the heart arteries, fixing them actually sometimes can reverse the symptoms of congestive heart failure and even the contractility of the heart.